Welcome to the first in a series of interviews, discovering what a day in the life looks like for some of the team at Renovo Care Group. Renovo Care's an independent specialist provider of assessment, treatment and rehabilitation for adults with neurological conditions. These can include acquired brain injury, stroke and progressive neurological disorders. Its highly qualified multidisciplinary team offers exceptional care that promotes and supports the very best rehabilitative outcomes possible. I'm joined today by Pessoa, who is the Arts Therapist Clinical Lead based at Holland & Park Hospital in Kent, to hear about her working day and to find out a little bit more about music therapy. Welcome Anna, and thanks for joining me.
Thank you for having me.
I'm sure at Holland & Park Hospital for you 2 days are never the same. But give me a brief overview of what a working day might look like.
Yes, so a working day, of course, starts with emails. It moves on very quickly to patient sessions. Then I usually write patients' notes. I might have to attend review meetings. I also attend a multidisciplinary team meeting we host every week, where we discuss patients individually. And of course, it involves planning next steps of treatment.
Now, I know from what you've got behind you in the picture, music therapy is an important part of your work. Just for those of us who don't really know, what is music therapy?
Music therapy is an allied health profession in the UK, and in a nutshell, it is the clinical and evidence-based use of music to achieve individual goals.
And at Holland & Park Hospital, what sort of patients will receive music therapy?
So the patients that receive music therapy are the patients that come to us for acute neurorehabilitation.
Firstly, what does it entail? What will they do?
So music, it's really fascinating because it's a whole brain activity. So it's the only thing we can do as human beings that activates the whole brain. So it has tremendous potential in terms of rehabbing both speech, physical movement, cognition, and so the sessions in this particular setting revolve around these three main areas.
And so do the patients actually play music, or do they listen to it?
They do, they absolutely do. So to attend the music therapy session, a patient doesn't have to be proficient in playing any instrument. There's no right or wrong. That's what I always say to my patients. We just use music as a medium to achieve usually functional goals. I'll tell you an example. If a patient has severe left side neglect after a stroke, I'll have them play a set of drums, for example, so they can play all around and they can acknowledge their left side. And I'll play with them, and it's very much in an improvisatory manner that we do this.
And do you see real benefits to the patients who undertake the therapy?
Yes, absolutely. And they see it themselves, sometimes instantly. I have patients who come and won't be able to speak, for example, after a stroke, but they can sing. And they can sing the whole words. We can really understand them, but when it comes to speech, they won't. And that's just because music and speech are in different areas of the brain.
That's really interesting, Anna. We've just got a little bit of audio here that really demonstrates and brings that to life. So you obviously involve each session or plan each session to suit the individual and what their needs are.
Absolutely. Each session is tailored for the patients, and hence that's why it's so time consuming. I spend a lot of time reflecting and planning the sessions so they suit the tastes of a patient. It wouldn't be appropriate for me to come to a patient or to have a session using, for example, rock music if a patient loves jazz, because it wouldn't resonate with them, and I want them to be as comfortable as they can be in a session, so the treatment is efficient.
And is music therapy actually regulated in this country?
Absolutely it is. So to be a music therapist, one has to do a master's degree, and then they have to be registered with the HCPC, which is the Health and Care Professions Council, and only then we can practice as music therapists.
And is music therapy the same as neurological therapy, or are there some differences?
Well, so neurologic music therapy is a specialization that anyone can do after or during their training of music therapy. It is based on the neuroscience research of music perception and production, and it works in these specific areas I mentioned before: speech, movement, and cognition.
It's absolutely amazing. There's so much more to it, I think, than anybody realises. You've obviously got to understand the workings of the brain and how the music affects that. And do you get really good feedback and outcomes from your patients?
I do. It's really rewarding to see how patients embrace it, and also their families, because they see the immediate benefits. They can immediately speak or sing, and then of course our goal, the ultimate goal, is to transform the music we do into non-musical goals. So seeing the singing going from singing to speaking, or some movements we do that might involve a little bit of dancing or marching, getting translated into walking, for example, it's really amazing and rewarding.
That's absolutely fascinating. Do you think that music therapy is going to continue to evolve, even more scientific in a way?
I believe so. This is a fairly new profession. In this country, it's a little bit over 50 years old, and there's lots of research that needs to be done still. And in the last 5 years, I dare say, has evolved immensely, especially in this more scientific part of it. We all want scientific evidence, and I think we are in a really good place right now to carry on that research and get it going, especially in the stroke area, which it's really lacking at the moment.
Thank you so much for giving us a little bit of an insight into music therapy and just how scientific it is. And it's been great talking to you. So if you want to know anything more about Renovo Care Group, or about the therapies that it offers, the care, support and treatment, please check the website on the screen below, or just Google Renovo Care and you'll find out all about its hospitals and the services they offer.